I want to welcome you, interns, or I'll call you externs, to this lecture. But I'm not going to do that without acknowledging the presence of Dr. Ghanaian Nauro, a senior colleague on this call. And I'm sure you had the opportunity of listening to his wealth of experience yesterday. I also see Dr. Stephen Okwada. I want to believe I know him. Also, I think I've met him once or twice. And that is the reason
yes, sir.
why.
Good morning, sir.
Yeah, how are you, Stephen?
Very well, sir.
Yeah, that's nice.
Yes, sir. Thank you,
So
sir.
we will start this class, and I want it to be very interactive, despite the fact that it's a large class, and I believe the technical people would be able to control my kind of lecture this morning, because like I want to ask questions from you guys, and I want us to talk to ourselves as if we are actually facing ourselves. So the title of my talk this morning is Essentials of a Good Consultation. I want one of you, perhaps those who are in 600 level, to give me what they know about what consultation means. Anybody can answer the question, and like, please, you don't want to tell me you don't know it. So what's consultation in a clinical setting? I'm listening, please.
Hello, this is my name is Mubarak Ali.
Yes, just keep the greeting. Just let's go. What's consultation?
Consultation assistant is the clerking way of clerking a client by assisting him through the animal he brought to the clinic. Thank you, sir.
Can I have another definition or understanding of consultation?
Okay, sir. Consultation is actually a way of seeking medical advice from an expert whenever you face a medical challenge.
Okay, seeking advice from an expert, medical advice from an expert. Yes, that could go. Can I have another dimension to that? Another person letting me know what consultation is. Let us be interactive. Don't worry. There is no caning here, no punishment, nothing. We're just friends. Even if it doesn't mean anything, just tell me. It doesn't mean anything, just tell me.
Sir, consultation means process or the process in which two people have like a contact or discussion formally. So if we talk about clinical, with respect to medical, like interview or speech or discussion formally.
Okay, class, thank you very much. Nobody is right, nobody is wrong, rather. We are all right. It depends on the perspectives from which we're looking at the meaning of consultation. Because it's not only in medical practice that we have consultation. We consult with a lot of professionals because we want to know about what they profess, or because we want to have an understanding of the kind of situations we have, and we believe they are experts who could put us aright. Now, the next question would be, who is a clinician? Who is a clinician? I don't want a downtime. Who is a clinician, please? Anybody can answer that question. Who is a clinician? You should know. Class, who is a clinician?
A clinician is
A clinician is what? I can hear you.
okay. A clinician is a professional, either in medicine or other fields who, in medicine particularly, who have an idea about cases or about a profession. It's like a clinician has I don't know, it has like an expert in a particular field, and in veterinary medicine, a clinician is someone who can diagnose or suggest a particular therapy to a client.
I like your answer. An expert in a particular field. Good. Now, can anybody assert the meaning of a diagnostician? A diagnostician. A diagnostician. I'm satisfied with your definition. What about a diagnostician? Who is a diagnostician? Yes, I can see your hands raised. Yes, please go ahead.
Clinician with the ability to diagnose or ascertain particular disease.
Can you repeat yourself, please? Can you repeat yourself?
Diagnostician is someone that can diagnose or determine a disease or cause of a disease.
Is a clinician a diagnostician? Can somebody answer that question? Is a clinician a diagnostician?
Diagnostician is a person who can, it's a part of what specialist that can make a diagnosis. So in this case, a clinician, if he is specialized to make a diagnosis, is also a diagnostician.
I see the way you wrote everything in, but you are not wrong anyway. But I want another person. I want another perspective. And I'll ask the same question. Is a clinician a diagnostician? Yes, thank you very much. Who is that?
No, sir. All fall under clinician is like a broader way of classifying experts, but diagnostician is specific. They carry out diagnosis like through any methods just to know the cause of the disease.
Thank you very much. You see, the beauty of this class and the beauty of the answers you have been given since is the fact that none of you is wrong. You have all been right, but it depends on the perspectives from which you are seeing it. Essentially, what I'm going to talk to you this morning, I think with the background that we have created, I think we will all enjoy ourselves because it's going to be this interactive and it's going to be a 3-week series. But today we are just going to take it from first principles. From next week, we get into very serious business. But the thing is, what we are going to do today, if you don't have it, you cannot proceed. I would go ahead and give you the meaning of everything I've been asking you from my own perspective. I asked myself, who is a clinician? And somebody has said it. He says the word clinician is a broad term that applies to any health professional who works on one-on-one basis with patients, diagnosing, mark that word, or treating illness. It may be a physician, veterinarians like you, a nurse, a psychologist, a speech language pathologist, anybody who is able to work one-on-one with the patient to treat and diagnose conditions. And I said, all doctors are clinicians. And I'm going to ask you a question here. All doctors are clinicians, but not all clinicians are doctors. Who believes me? Class, I need your answers. All doctors are clinicians, but not all clinicians are doctors. Hands raised. I want hands to be raised. Because the answer is right before you.
Yes. Yes, sir.
So somebody should talk. Validate that my definition of clinician. The answer is right before you. All doctors are clinicians, but not all clinicians are doctors.
Yes, sir. From my perspective.
Yes, what is it?
All doctors are clinicians, but not all clinicians are doctors. Is right? Because like your definition said, any health professional who works one-on-one with patients diagnosing or treating illness. So there are many sectors to the definition. But the fact that not all clinicians are doctors is right because some clinicians could be nurses, could be midwife experts or something like that. So they can help with the daily conversation with the patients and then maybe diagnosing.
Fantastic. I'm okay with what you have said so far. Because if you think about, let's say, professionals like speech therapists, for example, or physiotherapists, for example, they sit one-on-one with you. They diagnose what your problems are, but they are not doctors. And they can treat you if they apply their techniques onto you. You understand? So I don't want you to go home with say, oh, because we are doctors, we are only clinicians. No. The clinician is anybody who is able to sit one-on-one with you, with patient, or with you with a problem, and who is able to diagnose what your problem is and treat you. He may not necessarily be a doctor. So I want you to have that at the back of your mind, because we are still going to use it. Then the next question that I've asked you is, who is a diagnostician? It's also a broad term. It's a professional. In this case, you being veterinarians, who diagnoses and treats medical conditions and solves complex medical mysteries, like you will be solving in a few years' time. For example, too, a veterinary laboratory personnel that processes samples collected as a result of a conviction during physical examination by a clinician, or a veterinary nurse or veterinary technician to aid clinical diagnosis. It can also be said to be a diagnostician. For example, if I put a dog, or I'm in a farm with some poultry, or in a farm with sheep and goat or whatever, and I'm able to collect samples because it's a conviction from me that, oh, I need to draw blood. Oh, I need to collect fecal sample. Oh, I need to collect urine sample, you know, and I'm not going to be the one to do it. And I pass it on to somebody else who is going to do it and then give me the result through which I'm able to reach a decision to say, this is exactly what is wrong with this dog, or exactly what is wrong with this cow, or exactly what is wrong with this flock of birds and all that. Then that person is also a diagnostician. So all this interplay of definitions, I want you to get them very well, so that by the time you are ready to be veterinarians, you will know your place in the scheme of things. But like I said, what we are going to discuss this morning briefly in the next 40 minutes are things that I think you should be equipped with first before you can say you are a vet. Because before you can say, oh, I know exactly what I'm doing, and I can actually step on a platform to be heralded as a veterinarian. Because if you're not a good veterinary clinician, honestly, you are not able to do anything. You just be looking at the animal because you don't even know where to start from in the first instance. So I say, what are the attributes of a very good clinician, which all of you are prompting to be? And please take your notes. A very good clinician must be a very compassionate person. Somebody will say, studying veterinary medicine itself connotes something. You must have love for animals. Unfortunately, most of us reading veterinary medicine are perhaps people who have been rejected from human medicine, or who have been rejected from pharmacy or from biochemistry. Can you still hear me, please? Because I cannot see your own pictures again. Can you hear me?
Yes, sir.
Oh, fantastic. So you must be a very compassionate person when working with animals. You must be gentle at all times. I don't like when people just take animals anyhow. They just hold them anyhow because they're animals. No. Someone will say, oh, the threshold of animal to pain is high. And so what? You have to be gentle. You must be a very gentle person. You must be a very empathetic person. Somebody who is able to read through the emotions of that animal any animal before you. You know, you have to read through, you must be able to read the dog's eyes, you must be able to read the cat's eye. You must know the signs of pains, signs of distress, signs of when they are happy. You have to be knowledgeable about the animal, especially their peculiarities, their body languages. You must be that to be a good clinician. And again, you must be able to also show respect to the owners of the patient, because unfortunately, you are dealing with two beings. You are dealing with the client, or you're going to be dealing with the client, and you're also going to be dealing with the animals. That is why you are unique doctors. So you must be able to show respect, you know, to the clients. You want to be able to identify with their positive emotions or negative emotions, so that you can instruct what you have as relationship to them at that time. And then during your consultation, which we have said, you define yourself as an interaction between a client, and a veterinarian or a doctor, in order to be able to solve a problem being brought by the client, then you must be bold enough to let the owner know the truth about your consultation. First of all, I would want to say, before I go further, that although it's outside the scope of this lecture, but it is something that I want to say. As budding veterinary students or veterinary doctors, so to say, the areas of our operations are very diverse. And I must let you know, we work on the farms, especially when we're dealing with livestock and live birds. We work on the farms. We work in the clinic. And I don't want you to just look at the setting of a veterinarian, of a veterinary hospital just being a small animal clinic. But the small animal clinic is just like the human hospital. Yes, your excuse for the farm is there, but you cannot say even the farm itself cannot be neat. So your small animal clinic or hospital should be very, very neat. It should be extremely neat. Next week, I'm going to show a few videos of clinics or hospitals I know in Nigeria that are very, very nice, so that you know exactly what I'm talking about. It must be very neat. It must be devoid of smell. Nobody should enter that clinic and knows that, oh, it's animals they are treating here. If I enter your clinic and I perceive an odor, and I know there is a veterinary clinic, then you have failed with me, for God's sake. Because there shouldn't be any excuse for that to happen. Then the special arrangement of that hospital must be such that permits the kind of work that is done there. Your reception must be nice and cozy and cool. Your consultation areas must be well demarcated. Your treatment area should be well demarcated. Your laboratories, your surgery, your everywhere, your imaging, every room, if you have. And if you don't have all such things, you can also do some nice demarcation that would, expose you as someone who cares about the environment. So that is very, very important. Because if you are not welcoming, if your environment is not welcoming to the client, then you have missed it. You have missed it completely. So that is just an aside. So I've talked about you being compassionate, right? Yes, sir. I've talked about decision-making skills. Your decision-making skills should be top-notch. You must be able at every time to examine that particular animal. We are going to do about the examination next week. To examine that particular animal and be able to tell the client that this is my opinion. It may not be a conclusive opinion, as it were. Even if you are making your tentative diagnosis, you have to be able to verbalize. When you are examining that dog, verbalize. When you are going to collect samples, verbalize. Let the person know exactly what you are doing. Oh, I'm looking at the eye. I'm looking at the mucous membrane. You know the mucous membrane, when you look at it, it could be pale, it could be pink, it could be, you should be able to, oh, I could see some level of hemorrhages coming because there's something we call petechiae. So many things. Oh, the mucous membrane is injected. And you will be telling the owner what you are seeing, and you'll be telling the owner the implication of what you are seeing. So that by the time you are making the decision, you should be making a decision that is top-notch. Whether conclusive decisions or temporary decisions, it must be something that you have to learn. You have to learn it. I don't want to be with a doctor that is dumb. He's just touching the dog, touching the cat, touching the animal, touching the pig and everything, and he's not saying anything. And he will just come and be writing prescriptions. No, don't be those kind of doctors. You should be able to discuss. Your communication skills is very important with your client, so that they know exactly what you are doing. If you are examining the nose, if you are examining the ear, tell them what you want to see. Tell them what is abnormal. Tell them what is normal. That is what I do. And because if you do that, there will be a lot of confidence building in the process. A lot of confidence building in the process that the client will show. Then I said social interpersonal skills. A good clinician should have very good interpersonal skills when you are talking. That's what I said so. The owner does not just come in and you are just like, good morning, good morning. No, you must be able to interact with the owner. Oh, good morning, sir. Good morning, ma. How are you? I was working yesterday. If you know the name of any of his kids, oh, I Bola. I hope she's gone to school this morning. You must be able to know. You must be able to know. Know them by their names. Know them by their names. Know the dogs by their names, except it's a new dog. You must know your owner by its name. I mean, by her name or his name. And then you must know the name of the dog. Don't say, how is your dog? What do you mean, how is your dog or how is your cat? No. You must be able to say, how is Timmy? Oh, did you bring Timmy, or was it Rosie that you brought? You know, because you have probably not seen the dog or something. But you must be able to do that. So the guy knows that you have connected with him. You have connected with his passion, which is the passion of keeping dogs. He knows already. You understand? So if you don't have social skills, you know, you are not going to be a very successful clinician. You must be able to connect with your clients socially. You know, you must know their birthdays. You must know the birthdays of their dogs. Even if you don't have to have it off air, your office can have reminders that will tell you, oh, it's Rosie's birthday tomorrow, or it's going to be Timmy's birthday on Wednesday. And they send messages, you know, birthdays of their children, important milestones in their lives. That is when you can retain them. That is how you can retain your clients. So social interpersonal skills is very, very important in being a very good clinician. Management skills is also very important. You don't want to just treat your clients shabbily. You must be able to manage your correspondences with them. You must be able, for example, let me just tell you something. Like, for example, in our clinic, every day, if all the clients that will come today, whether they came for vaccination or a very serious condition or whatever, you know what we do? And I want to tell you today, tomorrow they are going to get a call. They could be 10, they could be 50, it could just be one. They are going to call what I call after visit call. We will call them tomorrow morning. Hello, good morning, Mr. Odukoya. I hope the night was good, everything. How about Timmy? I hope he's improving. Because you want to ask them about what happened at the consultation yesterday, even if it was just vaccination. Oh, I hope Timmy it's fine. I'm just calling to check on Timmy. And you know, they always get an after visit call. It's important. After the after visit call, when we now know that, see, we are going to have them again in another 2 weeks. We call at 2 weeks to the time, we call at a week to the time, 3 days to the time, and a day to the time. Some of them say we disturb them, but the percentage of those who say we disturb them are not many. So we don't really care about saying disturb you, but it's about protecting our business. It's about making sure that those people that we have caught in our niche stay within our loop. They don't go outside our loop. So your management skills must be top-notch. You must be able to maintain your clients. You just must be able to maintain your clients. You have to make them feel special. That's the thing. Then I always tell my people, when anybody comes to the Truthman's Animal Hospital or come to your hospital, give them that wow factor. You know the reason why you have to give that wow factor? Because every doctor, including the one down the road on my street, we all know veterinary medicine, we all know medicine. But there must be that extra factor, that X factor. I'm sure you all watch X Factor on Netflix. That X factor that you must give, you must dispense for people to continue to come to your clinic. There must be that X factor. So identify that X factor of that particular client, what he loves. And how do you know? In having conversations with them. I know some of my clients that the only thing they want to discuss is politics. I know some of my clients that the only thing they want to discuss is, are you obedient? Sometimes I say I'm obedient because I don't want problem. No, we'll get to a place where I'll tell you that you have to play the fool. Sometimes I will tell some people they know me as PDP person. Some people will say I'm a Milocon. I only make sure that I play the game to the moment. Some people, they are techie. They want to discuss about technology, innovations. That's what they want to discuss. So know what your client needs. Know the interaction. Some of them, for 20 minutes, we are discussing other things. We have not even concentrated on the dog that they brought. But you know, it's good for business. Because at the end of the day, by the time you slip your bill to that guy, he's paying. He's paying because you have engaged him. You know his X factor. So that's why I say emotional intelligence and empathy. We have been saying everything. You have to have emotional intelligence. You know, in recognizing animal emotion and then human emotion, and you respond to those emotions accordingly. You know all this one I'm talking about, you have not even started examination. It's just about something you have to have, because you can't give what you don't have. So these are the things that even if you don't have, you have to try to see how you can develop and imbibe. So, and we have said it, good communication skills when discussing with owner. You don't want to be a doctor that will be slaughtering or that will be stuttering. You must be clear in your words. You must be clear in what you say. You start to stammer or stutter when you are not sure of your facts. Whereas these people, Dr. Google is there. Everybody goes to Google. They will have an idea of what is wrong with their dog anyway. You understand? And then what do? If you don't know, you start to stutter. Some of them will tell you, they already know the answer. They are waiting for you to fail. So the clients of today are not the clients of 30 years ago who believes what to say pronto. These ones, they know. And then you must be dexterous. You must be able to shift from one ground to the other, fast, in terms of your thinking, in terms of your techniques, in terms of everything. So those are very good attributes of a good clinician, you know, of a good clinician. Then another very good one, because you have a lot of cantankerous owners who will come. It's just to come and destabilize you. They just want to come and destabilize you. And if it's not in form of a human, it could be in form of an animal. You get to a farm, and the history you hear that cow or that horse kicks everybody. You understand? And then you must be able to and I mean the animal itself has a problem, but you must be able to deal with that animal. You must be able to deal with that client who will not believe you, or who is just there to make sure that you fail. So your ability to stay calm under pressure is a very good attribute that you must have. You must be able to deal with anxious pets, and then you must be able to develop capacity to tolerate unpleasant situations. Imagine you are trying to examine a cat, and the cat scratches you, like that, scratches you and ready to maul you if it's possible. Some dogs are ready to bite you, even from their muzzle and everything. The very first bite I got in my life when I was in pet care was through a dog muzzle. I never could believe that dog would bite me. Or did that dog bite me, beat me through a dog muzzle? You are trying to deal with a patient, and then he just urinated on you, defecated on you. You must be able to control your emotions. You must be able to still calm under such critical situations, especially when the client is there. A quick story. This was almost 30 years back. Normally, at that time, maybe you know that I needed to wear gloves. But what I do is that when I'm examining, if I think I've examined a part of the dog, I go to wash my hand, come back, wash my hand. And I didn't know that I was incurring the wrath of the owner. And at the time, she just asked me to stop. I was asking Dr. Bede to, and it was like, yes, what is the problem? He said, he feels my dog is dirty. In the last 10 minutes, he has washed his hands about 5 times. He's not a dog lover. You understand? So I I didn't know what I was doing was not, it wasn't feeling nice or looking nice to her. So Dr. Bellina asked me, what have you been doing? I said, I've not done anything wrong. I've just been washing my hands. And she was complaining about me washing my hands. So you can imagine if I stood calm, that pet having some words, I mean, we would have lost that client. Of course, my principal came to tell her why I was doing that, and it was what I did all the time and all that. So she calmed down. But those are the kind of things you will see. Some people look at you, they don't even believe that you know nothing. They don't believe that you know nothing. So they are not even believing your actions. So, but you have to stay calm. You have to tell them that, yes, you still have your ace. You are holding that ace. Huh? Then mental and physical fitness is also a very good attribute of a good clinician. You know, sometimes we stand long hours for surgery. Sometimes you have to lift very heavy equipment. Sometimes you have to shift very heavy equipment. Sometimes you have to do so many techniques that will involve you, especially during orthopedic procedures, for example, when we all become engineers and carpenters. You know, you have to be able to drill. You have to be able to apply screws, pins, everything. It demands a modicum of mental fitness, and which you must have as good clinicians. Some people tell me that there are no males in veterinary medicine. Everybody is a man. Even though the thing is changing, we're having more women now all over the world than men. You know, but you must have that mental capacity to stay fit, you know, as a clinician. Then you must be adaptable. Any case can come at any time. You can have emergencies even in the middle of, you must be able to say, yes, I am going. I recall when we were in at least Abuja, it was Saturday. And I was telling Dr. Naro, who was seated by my side, my doctors have gotten home when they called them back. That we had an emergency CS. And everybody had to rush back to the clinic, you know. So you must be able to be adaptive. You can't say, because I have my resumption time, but my closing time is 6 o'clock and I have to go. No, you must come back. Even though we have people who are always on call. Sorry, it's just those normal disturbances. I'm going to have them in the next 2 or 3 minutes, but I'll come back with you. So adaptability is a virtue or an attribute that you must have. Then enthusiasm and positivity. Because of the stressful nature of the profession, you should always maintain a positive attitude to life. You should be upbeat. There should be no dull moment for a veterinarian. Because you really have to tell, because we're a very resilient profession. You know, no matter what is happening, we're a very resilient profession. So you must keep your enthusiasm high, then ability to dispense your sensory organs. Please, if you do, this is very critical. I'm going to stay like 2 minutes on this. You must be able to feel. You must be able to see. You must be able to hear. You must be able to touch and feel what that touch means. You must be able to smell. There are certain diseases that it's just by smelling that you know, especially for smell, for example, ketoacidosis. When you have sweet smell, fruity smell coming from the mouth of the animal, you have to touch. When you ballot, when you palpate, when you percuss, you have to be able to hear sounds from your auscultations. You must know what they call a wheezing sound. You must know when it is fluidy. You must know crackles. You must be able. You have to use your eyes to see those mucous membranes. You have to use your eye to know whether that dog is ambulating well or it's not ambulating well. You must be able to see whether it's an adduction or an abduction. You must be able to distinguish all those ones. And then you must be able to feel, oh, he's feeling warm. Oh, he's feeling cold. Oh, he's a bit rough. Oh, he's smooth. And you must be able to critically know how to describe these feelings. And I'm saying again that your hands must be gentle. And as a good clinician, you must be organized. Whether you like it or not, you must be organized as a good clinician. Yeah. Before we go to the issue of history taking, let's come back to class. I need 3 of you, one after the other, to tell me what should be the attributes. Mention 3 or 4 attributes.
Yeah, no, it's not sorted. Network has gone up.
You don't get password. No problem. You. Hey. No.
But we still there. I said we still there on the
No. Yeah.
microphone is not.
Can you hear me now? Hello?
Yes,
What was my last speech that you heard? What was my last statement that you heard?
Yes, you said 3 people tell you 3. You didn't say you just said not 3 people to tell you something. But you didn't say what.
I cannot hear clearly. Was it when I said 3 of you? I mean,
Yeah,
that
yes,
I need.
sir.
Yeah, okay, fantastic. Can I have volunteers? Attributes of a good clinician that you must possess as a vet. I want 1 person to tell me 3. Please, let's be fast. Oh,
Okay,
we
sir.
have less than 20 minutes. Yes.
You said as a good clinician, you have to have good social interpersonal skills. And you have to be a
Yes.
good communicator when conversing with the owners. And then you have to be physically and mentally fit.
God bless you. Can I have another person?
Stay calm under pressure, emotional intelligence and empathy, then positive vibes only.
Fantastic. Good.
Yes.
Next person.
Yes, ability to come to what I mean as in midnight, the client will call your attention, ability to adapt and call so that to attend him at any moment.
Yeah, you have just told me 1. Any other person wants to try? I need 3 from you. I gave you almost like 18.
He or she must be compassionate, must have
Fantastic.
he or she must have a good sense of to feel touch and likeness, and gentle and understanding.
Okay. Now, the next question before we go to the second half of the lecture is, out of all those things that I've mentioned, and I know we have about 19 or 20 of you there, do you think you possess some of those attributes? Do you think so? Can somebody be up to tell me that, yes, I have most of the attributes, but I don't have this, I need to develop it? I want somebody who is the most truthful person in that class. Own up to your deficiencies, please. Can somebody stand up? Don't laugh. It's about owning up to your problem, because once you own up to that problem, you will be able to solve it. Yes, somebody is using. Okay, fantastic.
Okay, so I have most of it, but then I don't think I have issues with working under pressure. I get confused quickly, and maybe I have to work on my communication skills too. I think I need to develop a little love for pets, because I have issues with that too.
You have issues with what? I cannot hear you very well.
I have issues with pets, actually, with animals generally.
Okay. So out of all the animals in the veterinary space, which one do you like? Which one do you like most? Or you don't like any?
I don't think I like any, but then I'm not scared of the animals, but I don't really think I like it.
You don't have a connection with them, right?
Yes, I don't.
Can I ask you a gentle question? And please don't take it as an affront. Why are you in veterinary medicine?
I found myself here.
Don't kill me, I beg. Please. What class are you? What class are you now?
Level 4.
Fantastic. We will talk later. Oh yeah. Can I have another honest person? Who is the other honest person?
Yes, sir. I represent some of the attributes, but one thing I know is I have issues with self-aware or I don't know, these clients that tend to know more. Because I've had multiplications with some whereby they attack my doctor and being just feel like, why did you so I attacked the woman? Like that creates of tolerance with unpleasant situations is a thing I would like to really work on, because I get back they come and feel that they are no more.
Okay, fine. Can I have something from the back? Because I've not been seeing anybody raising us from the back. Please, somebody from the back.
Sir, I do possess most of them, but my compassion is tied with money.
Okay. Because of time constraints, let me just stop at this time. But I like those honest answers. And the reason why I like them is, once you are able to note what your deficiencies are or deficiency is, and you must be able, you should be able to work if you plan to stay in veterinary medicine. I don't know the name of the lady, but for example, you must try to develop love for animals. Because see, veterinary medicine is one of the most, is the most beautiful, for me, is the most beautiful profession you can talk about. Honestly, because we're everywhere. We are doctors, we are pharmacists, we are managers, we are lawyers, we are everything that you want to think within the professional space is a vet. And then the guy who cannot stand when some clients say they know too much. See, you must allow them to exhaust themselves. I don't stop them. I do not stop them, honestly. I let them vituperate and they say anything they want to say. But because I know I have that superior argument to put on the table, By the time I finish them, they always keep quiet. There was a particular client who said, no, even in the human hospital, they are, if you want to be in the surgery, they allow you. I said, no problem, ma. I will scrub you off. I'll scrub you up, and then they will scrub that up. We put her, we just dressed her the way the other nurses dress. And I know I don't have anything to hide. It's about being confident for yourself, you know? And by the time I opened up my animal and she saw the first spot of blood coming out, she ran away by herself. I didn't ask her to go away. Maybe she wanted to be there. You understand? So you just show them that you are superior to them. But if you are the one that does not even know what you are doing yourself, then you become jittery. You become jittery, and they notice it. And they say that doctor does not know anything. And under no pressure, no client will come and attack you. Even if they attack you, you have to stay calm. You got to be the sheep. You have to stay calm because you're a professional. You understand? So please, each and every one of you, do that assignment yourself. Look at those attributes again, one after the other, and see which one you think, oh, you can identify with. And the other one, you know that, oh, I need to work on this one. I'm borderline on this one. And this other one, God, help me. Let me be able to develop this. Maybe by the time you become vet, you tend to now know how to do this. So that is about your attributes. So let's come to history taking. Let's read it. History taking is the process of obtaining information on the animal patient about its illness, onset of illness, feeding practice through careful questioning of the owner. So in veterinary medicine, you know, what happens is the animal does not come to the clinic by himself. No. It is the owner that either invites you, you know, or brings the animals to the clinic. In case of when you are dealing with farm situations, they call you, oh, and they tell you, oh, we have lost 2 birds today. Oh, we lost 10 yesterday. Oh, we lost 15 the other day. You know, and some of them are not even eating today. They are looking unthrifty. They are not drinking their water. When you go to a sheep farm too, or a goat farm, or to hospitals, they will give you a complaint. Or when they bring them to the clinic as dogs and cats and birds, they will give you a complaint. But it is for you to be able to take the history. Next week, we are going to do a lot of physical examination things, and that's what I'm really waiting for. But you see, history taking itself is an act. It's an act. If you don't know how to take good history from an owner, the idea of treating that case can be derailed from the start. Because some owners will come to confuse you. Some will come to tell you outright lies. Some will come and tell you half-truths. And you know the reason? The reason is that they don't want you to see them as the fault or as the one who has caused that thing. When an owner tells you the dog has not been eating for like a day, it's a lie. That dog has not been eating for 4 days. Have it at the back of your mind. Because he doesn't want to appear to say, the dog has not been eating for the past 4 days, and you are bringing it. He doesn't want to be seen as a wicked person. He doesn't want to be seen as a wicked person. Oh, the dog has not been drinking water for like yesterday. And then you are doing urinalysis and you are seeing very high specific gravity. You know the guy has been telling lies. The dog, you do cystosynthesis, you're able to remove urine that is so concentrated, deep yellow. You know the guy has been telling lies. You know? So because of your own superior knowledge, you just let them say whatever they want to say. My practice is, what I do is, no matter jargon, no matter what jargon you are talking about, I'm writing them down. Either you are writing them in a file, or when you have an electronic management system, you are typing. No matter what they say, just type. Because you are asking questions. And why is history taking important? It is to understand patient health from the perspective of the client. You can see that from the perspective of the client. In so doing, the history may provide clues about the patient status or disease state that are not overtly obvious to the clinician. For example, if the dog has not been eating, has been vomiting, and the guy does not even know, because they just leave their dogs or cats or whatever to roam around, they don't even know that the dog has been vomiting or the cat has been vomiting. It is perhaps you or has been having diarrhea. All they see that is not eating. What is you? Who will know? By the time you didn't do you see this, you look at the mucous membrane and you see it a bit dry. You look at you do your skin to gut test and you see that it's taking up to like 30 seconds or whatever for the skin to get back. You know, you are touching the cat or the animal is feeling warm in certain areas. You are looking at it. Oh, that can be so. You know, it is you who will punch that, but they will not tell you all that. It may not be obvious. So whether the history is related to any acute complaint, which will direct the physician to a diagnosis or not, you know, but the thing you have to know that history taking provides a foundation for the veterinary consult. Without taking the history from the owner, there's nothing you can do, because the dog is on your table or the animal you have been summoned to see on the farm is there, and then you're looking at it. You must be able to ask, when did this start? When it started, how did it start? Has it been eating? Oh, it's been eating and it's been vomiting. Oh, it's been having diarrhea. Has it been drinking water?
I don't know, because of the
You know? Hello? Is anybody talking to me?
No, sir.
No, sir.
Okay. So you want to be able to ask all those things. And you must know, because each of those questions that is answered by your client gives you a clue about what must have happened or what is actually happening. So let's go further. I want to be conscious of the time because I have a meeting that will start in another 20 minutes. Now, let's go further to say what constitutes history taking. There are presenting signs that you will see. Maybe the dog is dull, or in other words, we can say the dog is weak, is comatose, or recumbent. I'm just using words. It's not, I'm just using words, so don't take me serious about it. You know, is recumbent, is comatose. You are seeing those things. He's not enthusiastic to see you. He's just like, he's just lying down there. You look at the back rump, the rump of the animal, and it's wet. You can see feces there. You look at the eyes, and it's pale mucous membrane. You could see discharges. Is it purulent discharge? Is it like serous discharge? Is it unilateral? Is it bilateral? You are looking at some of the signs that you can see apart from what they have told you. So you look at the signs that you are seeing, and then you ask the person, when you have seen the presenting sign, when was the last time that you saw this particular patient being normal? That most of the signs that the animal is presented to you or is presenting to you were not there. Some of them may not know, they are not very close to their animals. And some of them will give you accurate answers. They will tell you, no, I think it was about a week ago. This started about 5 days ago, if they want to be truthful. Or this started it started yesterday. So you must know all that. Then one thing that we do not always ask for is past medical history. It's very important. What kind of diseases or conditions has it had in the last 6 months, in the last 3 months, depending on the age of the dog? Or what kind of illnesses have you been treating this? For example, if it's not your client, if you are seeing the dog for the first time, but if it's your client, it's your patient rather, you're able to have the history right in your medical records. And you may not even be asking the owner this, but in case you are seeing it for the first time, then you must ask. Then, has he had any surgeries before? Has he been spayed before? What other surgeries has he gone to? Has he been castrated or whatever? You must know what past medical history that your patient has. Then, very, very important, medication history. Some of them would have gone to quacks or to some people that whatever, or they are doing self-medication, and they are giving the dog so many things according to their whims and caprices and all that. You must know what are the previous medications, because perhaps it may just because the dog has been put on prednisolone, for example, for a very long time, that is showing Cushing signs. When you have Cushing, maybe the dog is showing like signs of Cushing disease. For example, if they tell you, oh, I have put it on prednisone for some time because it's been scratching, one doctor prescribed it. If you give excessively, yes, you can predispose your dog to Cushing's disease. So you want to know what kind of medications that the dog has been having. Then has it been dewormed? What kind of ectoparasitic control measures are you using? Are you still, is he on Simparica? Is he on Bravecto? Or are you still doing a tick spray or whatever? You want to know what other preventative care apart from ectoparasitic control has he had? For example, vaccination history, your deworming, whatever, all those preventative care, you know. Then you see maybe, oh, you examine the oral cavity of the dog and you see some mobile teeth. Or you want to know, has he ever done scaling and polishing? You want to know, you know. So you must be able to assess what has happened in the past in order to know what is happening now. Then trauma, has he ever had trauma in any place before? You want to know. And because these answers are not very easy answers that the owners will give you, especially if they're not very close to their animals. Then one thing I also do is to do an environmental audit of owner's compound. I don't just allow dog to just come to my hospital anyhow. One day, within the 0 day of registration to 120 days of registration, it's either I go to the house or I send a senior doctor. I want to know how that house is. I want to know where that dog lives. Because a lot of the problems are caused if you don't do environmental audit of the owner's compound. Some people, they have their dogs in compounds where you have a lot of plants that are poisonous to dogs. Some to places where you just have ordinary sand and you have engine oil spilling from generators. There, you know, you have some places, you have places where, you know, it's a lot of rats. So you must be able to do environmental audit of your, you know, so you do it. So you ask about the environment. Perhaps you are seeing the dog for the first time, about plant grass, recent painting of the house. Then some dogs also have access to waste bins. These are very, very veritable information that you have to get. You must get it, access to waste bins, because some of them eat a lot of rubbish from waste bins, you know, especially things from tins and rotten food and all that. They are prone to all sorts of things that you can get. Then alimentation states and audits. We have said that whether he's eating or not, whether he's drinking or not, and everything. And then again, next week, we are going to go to this very well, examination of the oral cavity. No, we are going to enjoy ourselves next week because it says a lot about the animal. The act of taking temperature also gives you a lot of information about the animal. So then again, you want to know whether the dog is exercise tolerant or intolerant and all that. Oh, someone will say, oh, when I walk the dog, after 5 minutes, he wants to sit down. After 2 minutes, he wants to sit down. You already know the information you are getting about the lung capacity, about the heart, how do I say it? Capacity also. So these are some of the things that you would ask, you know, when you are taking your history. But I'm coming. Let's go to the next slide. I'm sorry, I'm past 1 hour. Yes, this is what I'm coming to. Clacking. There's a thin difference. There's not even a difference between history taking and clacking. But the act of history taking, for me, is called clacking. And then it has a lot of skills to it. I say clacking is a process of interaction with clients regarding a case, and it's a very important process. It is a very important process. Like I told you, have it in mind that some clients are ready to confuse you, some are ready to tell you half-truths, some are ready to tell you absolute lies. in order to just, take you off their lane, because they want to put everything on the dog or on their house helps. So during clacking, perhaps the dog is being referred to you. It is essential that you ask for a referral letter. What did I say? I can't hear you.
It's essential to ask for a referral letter.
Fantastic. If it's not a fresh case from you, it could be your patient. If it's your patient and is sick and the owner has brought the animal or they've called you to the farm, you have the records. You can trace the records. You can look at your records and say, okay, we have done this, we have done this, we have done this. Why should we be having this? But perhaps it's not your case. Essential, you have to ask for a referral letter. That referral letter must carry the name of the doctor, must carry the signature of the doctor, must carry the VCN number of the doctor. And it must detail what has been done. What was the complaint when the dog or the patient was initially presented to that doctor, and the actions that and then the signs that he saw and the action that he has undertaken. Everything must be in that referral letter. I'm told you are going to have exams later from all these lectures. I'm giving you expo. Yeah, that referral letter is very, very important. And I will repeat it. The name of the doctor, the signature of the doctor, his registration number, the name of his hospital and address and everything, the presenting signs that he saw, the complaint that he was given, the presenting sign that he saw, and the action he took, and the reason why he's referring the case to you. You must know, because if you just take it from the process of what you are seeing, perhaps it's a skin condition that is in the secondary or the tertiary stage of manifestation. You did not see the primary lesions. You are just seeing something already complicated by bacteria or by fungal organisms. They didn't tell you what was happening before. And then you are just left in the deep blue ocean. You understand? So that referral letter is very key. And then you must also be able to have a communication with that vet. Don't fight any vet. We are all the same profession. You should be able to place a call to that referral to the referring vet and ask about the case and all that. So during clacking, records of communications must be kept. And when I say records of communication must be kept, it's like your interaction with the client at that point in time, the questions that you are asking, and the answers being given, you must be writing them down. You must be writing them down. And I will repeat it, you must be writing them down. I've seen doctors who will just see cases and just look at cases and just start giving injection. And then after like about 4 or 5 hours before they go, they now, hey, bring me the file of Rusi. And they have forgotten. They have forgotten the details. Me, even when we're using file, my Bible is, as you are talking, I'm writing. As you are talking, I'm writing. If I don't finish writing and I've not decided my action, I don't ever discharge you. I must finish writing, reach my tentative diagnosis. If I'm going to take samples, I will take samples, and I will discuss with you my bill, everything, writing everything down before I discharge you. I don't ask you to go, and then I've not written anything in the file. And if it's the EMR that you are using, you are typing as the person is talking. It is important. Records of communication must be kept during clacking. It is very, very important. And then in referrals, you have to have the referral. I've told you. Then, do you have any useful collateral history, for example? Oh, peradventure, they just brought some puppies. And these are signs of believe the parvovirus or something. You are looking at that. And they will tell you, there's no other dog in my house, there's no whatever, I've never had dog before, this is my first puppy. You must ask all those questions. Did anybody come to your house in the last 1 or 2 weeks? Does he have puppies? Is he a breeder? You just have to have, your sense of reasoning must be up. You have to be upbeat. That's why you cannot be a depressed person and say you want to be a vet. No, 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 no. Because you are not going to be upbeat, you are not going to be enthusiastic, and you won't have any positive outcome anyway. So cognizance of the 5 C's, the chief complaints that they are bringing, the cause and cause of the illness. Sometimes you have to determine it. Then complication of illness, you have to determine it. And then any corroborating finding during exams. Most of this, we are going to breathe life into some of these things next week. That's why I'm not going to go into them so much because our time is fast spent, really. Yeah. What are the essentials of a good clerking? You have to make your patient and client very comfortable. I see some people fighting with dogs and cats, or fighting with the pigs, or fighting with the bull and everything. You have to make your patient comfortable. You have to make your client comfortable to make sure that the client knows that you know exactly what you are doing. It is very important. It is very, 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 very important. There must be that radiation of confidence, you know, from you to your environment, so that they know that they're in good hands. Then this is a new concept. Provide a fear-free environment. You know, it's a course that you can take for almost like 3 weeks now. Providing fear-free environment, especially for dogs and cats in your environment. There are some dogs that when they see your clinic or their owner parks in front of your clinic, they're already running away. They don't want to come. They start hesitating. It is because they have associated that environment of yours to pain or to some unpleasant situations. So decide to plan a fear-free environment. And what do you do with a fear-free environment? When the dog comes, don't let us be a situation whereby from the car to the table. It is wrong. Provide an environment where you play with the cat, you play with the dog, everybody rolls, you give treats and everything. Have a lot of treats in your clinic. Just give let the cat play with you, let the dog play with you. There are ways you can bond with your patient first. Bond with your patient first. Sometimes when we have them on the table, you want to give injection. You have wet foods that you at the back, you want to give injection. Somebody is in front giving the cat or the dog food. But you must have even finished before the cat or the dog knows that whatever. Or somebody is expecting it. You know, you must inspire confidence in your patients. And they will always want to come to your clinic. Go, because I'm going to ask you next week. Go and Google fear-free care. Fear-free. If I'm going to ever set you a question, questions for your review, I am going to set that question. I'm telling you. 2 1. Referral, the principle of referral, and then cultivation of a fear-free environment in your clinic. So that all your dogs, all your cats, or even when you get to the farm, the cows will see you, or the cattle will see you. Oh, our doctor has come. You know, they are welcoming you because they know that you are very gentle. You can read their emotions. You know when they are all right and when they are not all right. You can read it. So provide a fear-free environment when you are clerking, you know, especially for your clients too. Desist from being judgmental over your client's claims. Some clients will tell you some nonsense. Don't just pass judgment. That's not good, man. Why did you have to do that? You know, when you did that, you know, the dog will just beat you, or the dog will just no. Excuse me. It is for you to listen. Cultivate the habit of listening, the virtue of listening. Even when you know that they are speaking ultimate jargon, it's not your concern. Just listen and write down. Then again, in clerking, don't ask leading questions. If you ask leading questions, if the person wants to be like, yes, I want to look good in front of Dr. Nasir, Yes, now, you will give me the kind of answer I expect him to give me. But you are not helping the animal. That is why I will urge you to always ask questions that require specific answer. Mostly yes or no. Or what do you feed your dog? I want to know. Sometimes they lie. Someone will say, oh, I've been feeding dog food. What kind of dog food? Royal Canin. I hope you are listening to me. I hope you are hearing me because I cannot see you. Are you listening to me? Can you hear me?
Yes.
Okay. There's a Royal Canin. But you know what? Sometimes the dog disgraces them. Because the dog will now vomit and vomit ever. You think I've not seen it before? I've seen it before. Oh, what kind of food does your dog eat? Oh, I give dry food. Oh, fantastic. But in another 10 minutes, that dog vomited ever. Eh? What would you feel as a client if your dog disgraced you like that? I've seen it before. I'm not joking. I'm not just saying it. I've seen it before. You can imagine. So ask questions that require specific answer. And like I told you the other time, sometimes play the fool. Sometimes play the fool. You are playing the fool because you want to extract information from that client. You really want to extract information from that client. So play the fool, be writing all the nonsense the person is saying from what you are writing and from what you are listening to God Almighty who made me. You'll be able to know whether this guy has been saying the truth or has been telling lies. And then it will prompt you to ask further question. Then, as much as possible, I've seen that when clients are in a situation whereby there are other clients listening to what they are discussing with you, they want to tell lies. That is why most of the time I consult with clients privately. In our place, it's only a client at a time. But I know some hospitals design that what the doctor is asking the owner, the client, some other people can hear it. Or they have, like in some places, you have a doctor, a vet, and you have like about 4 or 5 assistants listening to the person. Sometimes it's not good. Apart from you and the person who is assisting, please, I tell you one thing, make consultations as private as possible so that you can extract the maximum information from that person. And like I said, don't be judgmental. Always see the point of view of the person, because you will ask, why didn't you know that this has been happening for about 4 days? It's a very wrong question to ask a client. Why didn't you know? It's like you're already passing judgment that is a useless person, an irresponsible person. Oh, it's been happening for 4 days. Okay, it's all right, no problem. Something like that. Let them feel good, but excuse me, my kind of person is bad. When I now finish my diagnosis, because you have helped me to reach my diagnosis, I've determined that I'm going to collect samples. We are going to talk about that next week. I've determined that I'm going to collect samples, maybe fecal, maybe urine, maybe whatever sample, or I'm going to do an ultrasound, or I'm going to go for X-ray and everything. And we are already getting in tune with what we think is wrong with that patient. I will now try to unleash my own dragon, one way or the other, telling the person what has been wrong, what he has done wrong, but in a loving manner. In a manner as, okay, if only I had seen this dog 4 days ago, if only I had seen this dog 3 days ago, we would have been able to spot this and would have been able to prevent this from happening. Okay, maybe next time, try to see if you can notice, see, like somebody was saying last week, there are several roads to Kaduna. Depends on which one you want to take. With this, I want to say thank you for listening. We have done about an hour, 15 minutes, and it will only continue next week. I am going to start with physical examination next week. We are going to run through how to examine the patient. We are going to run through how to do collection of samples and everything. And I'm also play some videos that I'm going to make myself. And I want to thank you for listening. But before I go, I want to know just from two people, to answer this same question. What do you understand by clacking? And what are the things, what are the events that you must do and that you must avoid? Questions. What do you understand by clacking? What are the events that must take place and what are the events that you must avoid? Let somebody answer that, then I will call it a date. I'm listening.
Yes, before they take the questions, some of them have questions for you. Would you want us to?
Oh, beautiful. Oh, fantastic. Yes. Okay, but let them answer my question first.
Yes, they will. All right, so who is answering?
Clacking is the process of interaction with the client regarding a case. And from what you said, it's the difference is just a bit from the history taken. It involves asking the client about the disease, when it started, what the animal was given, when the symptoms, and you said we should avoid asking leading questions, and we should make the client and the patient as comfortable as we can and provide a fair, free environment.
Okay, thank you. I'm happy that you're able to get all those within those last few minutes, and I'm showing my face now. I didn't want to get too distracted before. Now that you're asking me questions, let me show my face. Thank you all for answering that question very well. And then you can read more, because before we start next week, I'm going to review this class by asking you questions pertaining to these slides. Thank you. So can I have your questions now?
Good day, sir.
Yes.
In a case where they bring a very critical conditions, and you already asked us not to just jump into giving treatment, and the animal is in a very critical state of maybe at the risk of dying, but you still want to clack and get as much information as you can get. So how do you try not to lose the animal and still do the right thing?
Okay, let me just attack that straight from the beginning. The fact that I say you should not jump to treatment does not mean you should not learn what they call stabilization. When a client comes to you and is very critical, there's critical care that you need to give first. For example, an animal has come to you and is almost choking. You want to make sure that you practice the ABC. You want to establish the airway. You want to make sure that the breathing, is also restored properly. You want to also ensure that the cardiac functions are also in good state. So there are certain things that you do to stabilize your patient first. You understand? But you see, there's a problem. The problem is sometimes you do all those stabilization things, and then you finish, and then you charge for such stabilization processes, and the owner says they cannot pay. So what you do and what I do, yes, essentially we'll start work. But while we are starting work, you are making a deposit. Okay? And I'm asking you questions at the same time. These are events that will take place simultaneously at the same time, without making sure you are hurting the other. I will try to start stabilization. You are going to drop me a deposit as I'm doing that, and somebody is there with me, providing me with information to be able to help the patient. You understand? Because you cannot just say, you are just, where are you going to start from? Somebody must be there to know exactly why the dog was brought to you in the first instance. Was it an acute process that they didn't see about an hour ago or 2 hours ago or something? All those must be established. So the events that happens in an exam room is something you cannot contemplate. An exam room is a crazy room sometimes, especially when you have emergencies. So you have to deploy all your senses, all your arsenal, everything, to make sure that you do. But the one word is a critical case. Stabilization must take place. Yes. Next question.
Yes, sir. Thank you very much. My question is regarding the reference letters. So
please talk louder because I'm struggling to hear you.
Okay, my question is regarding the reference letter during clerking. She said
we have to bring a reference letter. So I know that in some vet clinics.
So my comment is regarding the reference letter must be brought by the client or the doctor who is referring the case. Because some doctors or some vet clinics they don't they don't write the drugs used or administered to the patients on any paperwork to the clients. They probably categorize it into antibiotics, epinephrine, the like. They don't specifically name the drugs. So that's my question comes in. Is it the doctor that is refining the case that will write the reference to the recipient of the data, or is the client that is bringing it to the hospital?
Thank you very much. We call it a referral letter. If it was the patient, the vet that will take it to the other vet, then there's no need to do a referral letter. It is the primary vet that first saw the patient that will write a referral letter to be taken by the owner of the dog to the next vet, the secondary provider. Just like we have abroad, you have primary veterinarians who do the basic things, and you have some level of secondary providers and then tertiary providers. Then, nowadays, and please don't fall into the category of just writing anti-inflammatory antibiotics. What is practiced now is evidence-based medicine. Why should I shy away if I can defend my therapy? Why should I write antibiotics? That is not a good bet writing a referral letter. If you have given oxytetracycline, 10 milligrams, IV, BID, that's another thing, just by the way. A lot of people give oxytetracycline just once a day, and it's crazy. It's rubbish. Oxytetracycline is 12 hourly, twice a day. So you must be able to write it. And I don't like the act of writing B complex, 5 mil, dexamethasone, 4 mils, IM. No, it is not the mils I want. It is the concentration of the drug that you use because of the weight of the animal. So I know that you have done the right thing. You will never catch me dead writing 5 mils of oxytet. I will rather write the milligrams. And I will write the name of the drug that I'm going to give. If I'm giving prednisone 10 milligrams BID or QID or SID or whatever, I should be able to defend it. 10 milligrams of prednisolone BID. I should be able to defend it. So it's not a question of they don't want to. If they are writing such a thing, report them. That is why the Vet Council is here now. Vet Council of yesterday is different from Vet Council of today. We have to change. Medicine is evidence-based. So in a nutshell summary, it's like, no, the client takes the referral letter to the secondary care provider. And then when you are writing the referral letter as a primary veterinarian, you must be able to state exact drugs that you use in the milligrams that you use them as a result of the weight of that animal. I don't know, I'm not sure this is going to be in the scope of whatever we're going to be teaching you during this internship. But maybe the doctors in the class will do, in the hospital will do that. But that must be done. Another question, please. Any other question?
Okay, I think that is all, sir.
That's
all, sir.
Okay. So Nancy, let me do what I should have done in the before we started. So thank you, Farmalert, for giving us the opportunity to be able to, well, I call it a form of mentorship, to mentor this our budding vets. And I want to thank sincerely again for the kind of opportunity you have also given to them, and for us to be able to have the opportunity to also render the services. And I want to thank your management again for particularly giving me the opportunity. I want to tell them that for next week, because I like them to flow essentially with me, the way it's going to be next week is that we are going to review this for about 5 minutes, and then you should go and read about physical examination of patients, not only dogs and cats, including cattle, sheep and goats, pigs, equine, and everything, because we are going to be taking everything together. Physical examination of animal patients. That is what we are going to be taking next week. Thank you so very much for having me, and I wish you a very good day. Bye.
Sir. Thank you, sir. We really
Yep.
appreciate it. We'll be expecting you next week.
I'm here.
All right, sir. Do have an amazing day. Thank you.
Bye-bye. And then Dr. Naro, bye-bye, sir.
Yes, Dr. Ganier Nauro. Thank you very much, sir, for joining. Please,
I missed his class yesterday,
Thank you,
but I
sir.
won't miss one for next week. No.
It's my pleasure to have been here. That was a great lecture, very great lecture. I refer to this kind of class as a master class from Dr. Nasir. Congratulations again to this wonderful set of interns. You can't have it better. You cannot have it better. Thank you, Tunji. Thank you.
All right, sir. Thank you, sir. Thank you, Nancy.
sir.
Thank you, everyone in the class.
Thank you, sir.
Yeah,
Bye.
Nancy, thank you.